to start and letting us all know what can we do today to improve our health and to improve our longevity. Dear Naveen.
First of all, I want to thank you for hosting me here. And I really believe that human longevity is no longer just a concept, because there is absolutely no reason for us to age or die from aging. After all, aging is just a chronic disease. And I think in terms of understanding the human body, time has come for us to be able to digitize, decode, and decipher the human body. For the first time, we are able to understand every gene that's expressed in our body. And I think the fundamental idea that there is a silver bullet, there is a one single supplement, there is one single things you can take that is going to help you live longer is completely a myth. Somebody believing that our genes are our destiny is a complete myth. In a sense, our genes have very, very small role to play in our lives. In a sense, it's our gene expression, and those gene expression can be controlled with our diet, with our lifestyle. And the big part of that is actually our microbiome, both in our gut microbiome and our oral microbiome. And they in turn modulate our human gene expression, including mitochondrial gene expression, that leads to many of the chronic diseases, including aging. And what we're really finding is that people who are going on these fat diets or fat supplements are in fact harming themselves. We just published a paper on biological age, which is the largest data set that has ever been published. We looked at over 100,000 people, their gut microbiome and their blood transcriptomics. That means every single human gene expression. And what we found was that in fact, the people who are on fat diet, like keto diet or paleo diet, or people who are taking a lot of these supplements, including the NAD precursor, are actually harming themselves, and their biological age is higher than chronological age. So many people somehow believe that taking these NAD precursor is helping them. And what we found was in people who have high cellular senescence, or people who have a high inflammation, or people who have high oxidative stress, in fact, these things end up harming you. So what we are actually learning is that there is a mechanism where you can start to look at for each individual, what is causing the inflammation, what is the underlying reason for us to be actually having our CD8 T cells, which are highly active, and how we can quieten them. Because we saw one of the biggest trademark, or one of the biggest hallmark of aging was the exhaustion and the less specificity of CD8 T cells. And I think by looking at personalized and precision supplements and precision probiotics, precision prebiotics, probiotics, and precision supplements along with our diet can actually influence our aging, especially our biological age. So with that, I'm going to actually stop here, Nuno. I'm not sure how much time I have, but I just don't want to be the person hogging up all the time. Thank you.
That was brilliant as always, Naveen. Brilliant. Dear Nichola.
Hi. So just back to the question. So it was like, what are the things we can do now, and what are the things in the future? And I think sometimes it is so easy for people to concentrate on, the really big plans that we do have for the future, and almost forget some of the simpler lifestyle things that do have good evidence that can be done now. And I know myself personally, I'm quite keen on advocating, the simple lifestyle changes like the fasting and, things like that, which have some really good evidence that they can reverse your biological age and increase your health span. And I think it's really important for us to educate the public that doesn't follow the longevity space on the actual impacts that some of these things can actually have. And it's things that they can put into their lifestyles now, because for some people, just thinking about those things is quite a step, never mind us starting to explain senescent cells to them, or, other things that we're really quite familiar with, but haven't actually reached the majority of people yet. But then having said that, there are really exciting things that are coming out every single day. And that makes me really excited for the future, and to see, which thing is going to happen first of all the things that we are excited about. But just to reiterate what Naveen said, it's not a silver bullet. It's going to be a combination of different things. And I think slowly scientists and, you know, even outside our field are starting to realize this, that biology is complex, and one thing is not going to fix anything really. So it's what combination of things are going to work.
Absolutely. Thank you so much. Dear Kelsey, your thoughts, please.
I won't focus on the things that we can do now, because I think there's a lot of people on this panel that could speak to those topics better than I could. So I'm interested in thinking a little bit about some of the things that are coming. One thing that's coming is big pharma. We do, with ICOR, a lot of contract work, and I can tell you that in the past year, the amount of interest that we've had from big pharma in the aging space and looking to put on new programs addressing aging a little bit more holistically, it's something that we haven't seen before, and it is happening, and there's a lot of movers and shakers that are entering the space, or at least trying to figure out how to enter the space. One of the challenges that we've kind of observed in our own development is the way that you create drugs to target some of these pathways of aging seem to be very different than how drugs have conventionally been developed in the past. Most of your small molecules, for example, will inhibit particular enzymes or binding sites or things like that. Same thing with your biologics. But I think that what we're going to see is new classes of drugs that function very differently than anything that's existed in the past. We're seeing, for example, a lot of interest in allosteric modulators. So the part of the protein that you're binding to elicit response isn't actually the business end of the protein. You're leading to, different conformational changes and stuff away from where you're actually binding. There's been a lot of money poured into those sorts of efforts. We're seeing a lot of differences in, as we explore aging cells and senescent cells. They appear to be regulated in ways that are very unique and outside of, some of your canonical mechanisms. It's not just whether genes are up or down regulated. It's not even necessarily, the specific proteins that are being made in post-translational modifications, but we're seeing new mechanisms described in the literature with liquid-liquid phase separations that have a lot more to do with how the proteins fold and interact in complex solutions. That, the physiology of young and old people are very different. We know this, but what hasn't really been explored is how that physiology changes in the cell and how that influences the most fundamental mechanisms of cellular function. And we're seeing a lot of literature opening up describing some of these pathways and offering very novel pathways, novel mechanisms of how those pathways work. And I think that's going to create a lot of opportunities for new classes of drugs that will, be able to modulate that. And again, pharma is paying attention. So that's very encouraging for me, and should be, I think, for anyone on the panel and listening to the panel as well.
Thank you so much, Kelsey. Dear Peter? Peter, can you hear me?
Yes, hello, yeah.
Dear Peter, your thoughts, please. Yes, thank you.
Yeah, thank you for inviting me. If the question is, what are we going to expect in 10 years? I think I would follow the comment by Kelsey. So personally, I believe that the drugs have been developed against specific diseases are not exactly the drugs which will eventually cure aging. So I think it's really revolutionary what's going on right now. We are allowed in a way by investors and by our pharma partners to think and actually develop drugs specifically targeting aging pathways. The problem with that, I would call this approach hard future pharmacology, is that I believe it will be effective, but it will take a lot of time to actually get to the people. First of all, because aging is not yet a disease, so we have to develop drugs against specific diseases, which means that these drugs will end up at doctors' hands in patients most probably very sick. So for example, we are talking about accelerated aging in patients who are suffering from chemotherapy, for example, in these kind of scenarios. This is quite a long way before actually healthy people will start getting these drugs. So I think that there is 5 to 10 years span before these drugs are actually developed, tested, and then then brought to doctors in such a way that doctors will risk, in terms of cost to benefit analysis, to administer them into reasonably healthy aging people, which means that through this time, we have to think about other options. And I would highlight two of them. Obviously, one of them is lifestyle. I mean, people know that they don't need to smoke, but people still smoke. So it's very hard to make people do lifestyle decisions. And yet we can have maybe up to 5 to 10 years of additional health span by lifestyles and diets only. So I think there will be some revolutionary companies made, which will help maybe with some digital tools to educate and control lifestyle choices by people to help them live for another 10 years. And then I think there is another angle. Like think about metformin. I mean, metformin is a drug which has been there for forever. And this drug is probably helping against aging. It's not a very strong medication, but it may work. I would also think about antidepressants, drugs in that space. We know that aging correlates with neurology. And I think that quite some generic drugs may have effect on aging. Simply, for example, some antidepressants may help you cope with appetite. So they can help you they can send you into caloric restriction state. So I think these drugs are actually around there. They're effective. They can be used by doctors right now. And if there were any system which would monitor biological age in humans, not in animals, but already in humans, and help to personalize these treatments for people who are already there, maybe some of these drugs will help people live for another 5 to 10 years longer, exactly till the time when the hard pharmacology, which we are doing and Kelsey has been talking right now about, will eventually get to every one of us. So I think this will be a combined approach, and I hope I outlined what may help eventually.
Thank you so much, Peter. Dear James, would you please share your thoughts with us too?
Hello, and delighted to be here. I think as a sociologist, I'm principally concerned with some of the social aspects of aging. And what we see in the United States is that life expectancy has begun to stall and decline for some parts of the American population. The principal causes of that has been despair of various kinds, suicide, alcoholism, drug abuse. There was a study published this year in PNAS looking at the predictors of mortality in the United States, and they found that in addition to these class-linked social behaviors like smoking, alcohol abuse, lack of physical activity, the other principal predictor they found were economic difficulties on the part of people, unemployment, and unemployment in your community. So I think we need to have a social approach to longevity as well as a techno-fix approach. I'm hoping that techno-fixes will come because it turns out that losing weight is very difficult, and surgery on your stomach seems to be the most effective method, at least in the United States, for getting people to lose weight. Hopefully we'll have better diet drugs in the future, exercise mimetics, those kinds of things. But I think one of the interesting things about the current moment is that COVID will supercharge, I'm sure, biomedical research in the coming years. It has given all of us a crash course in the therapeutic pipeline and how to accelerate it, and people's concerns with the safety and efficacy of various kinds of therapies. COVID is a disease of aging. It is, at least COVID mortality. Everyone can get it, but over 65, 85, your risks are so much greater. And so I think this is also an opportunity to focus on diseases of aging. It's an opportunity to focus on universal vaccine access. The lack of universal access to medicines around the world is another principal cause of mortality. And as Peter mentioned, I think we need to give a lot of attention to the clinical pipeline. Biomarkers of aging have to be determined and used as a part of clinical trial research. And this is a part of what the ongoing negotiations with the US FDA around things like metformin trials involve, is to try to figure out if we can eventually agree on biomarkers of aging as a clinical outcome. So I do hold out some hope for techno fixes, but I think if the world continues to go in an increasingly unequal direction, we'll have a lot of social issues to deal with along the way.
With María. María, please.
Hi, everyone. Thank you, Nuno, for having me. Thank you so much. I wish I was in Portugal right now, but I guess we'll try that next year. Yeah, so regarding, I'm a little more extreme in terms of what can we do today. I don't believe there's so much we can do today in terms of age reversal, which is the goal in my life and what I work for. I think, yes, we can do things to better our health and to stick around as long as time so that we can take advantage of the therapies when they come out. You know, things like rapamycin, NAD, supplements, senolytics, metformin, diet and exercise. We all know that we can do that stuff. I think it's not really complicated to know what a good diet is. People find all kinds of excuses not to follow good diets. But what we're trying to do here is it's beyond that, because even if you do all that stuff and everything that we do that we can do today, supposedly to stay younger, we will still age. We will still get the damage and you know, at a molecular and cellular level that we're having right now and that we always had. And it can, maybe we can extend our lives a few years, but we will eventually still age. So what we have to do is we need to change the way that we're treating aging today. The big paradigm of how healthcare works for aging, and that's what is failing. Obviously, we've seen change in life expectancy. People live longer now, but it's kind of bad because we're living longer in really bad state of health. So we're extending, sometimes I say we're extending agony because we are just extending the life of people who are very sick. Because when you age, you get very sick, which is basically what aging is. And what we want to do is we want to change lifespan, which has always been the same. We have not been able to change human lifespan, and that's what we're trying to do with the work that we do, for example, SENS Research Foundation, or the work that Kelsey is doing, or Reason. And those are the companies that we need to support. These are the projects that we need to support. And this is when we can succeed at this type of research, is when we're going to see a change in the mission that we're all here talking about. Everything else will help, but it's not going to change the way we age. So yeah, basically, I think that's my message, that we need to keep working really hard on changing the paradigm and changing the way we age, and not just finding things that are going to help us a little bit to live a little longer. But it's a more extreme thing, and we can all advocate to make sure that this industry advances as fast as possible, and that includes funding, which is critical.
Thank you so much. Dear Yael, can you hear me?
Hi, thank you for having me. I wish next year we can be all in Porto again, see people with legs. It will be very nice. So I would like to continue what Peter and James said. I think that we need to really examine this longevity space in three verticals. One is about pharma. The other one is social aspects with financial aspects. And the third one is about behavior and lifestyle. If one of them will move faster than the other, it will stop, it will put a barrier to all three of them and to all the movement that we call longevity or longevity space. From my point of view, I'm a CEO of a VC. Again, for me to invest money in the longevity space, I would like to see the whole three aspects moving forward together. If one of them, if the community is not ready for longevity, if there is no financial plans for longevity, if there are not good enough drugs or personalized pharma, then I will wait. And this is what's happening today, and this is what need to be different in 5 to 10 years. We must see the whole three aspects moving together, and then we will see investing in longevity space, and the whole space will be a success. Thank you.
Thank you. Thank you so much. Dear Andrés?
Hi, everyone. Here, Andrés from Madrid. Nuno, thanks for having me here. I'm enjoying a lot this conference. Well, regarding the question, let's say what we can do now or until the breakthroughs on life extension arrives. Well, first I have to say that perhaps one of these breakthroughs already is within us. And we may listen about that or hear about that tomorrow afternoon when Liz Parrish explains what she did on herself and what she's doing with other patients. Having said that, it's true that, I mean, in my case, what I'm doing is basically, you know, the typical things like healthy dieting, exercises, some geroprotectors. I practice metformin. Well, actually, the Nuchido Time Plus as a NAT precursor, NAT plus precursor. So all these type of things. I mean, I check my blood and it has improved in the biomarkers for the last, let's say, 3 years or so, which is when I started. So basically, again, healthy diet and exercises and geroprotectors. Then there are also technologies that are already available, like hormone therapies, which are more invasive. And again, gene therapies as well. So for the future, what I'm waiting is for, you know, the gene therapies to get a more common thing for a lot of people. Partial cellular reprogramming, what Juan Carlos Pisu and others are doing. And I'm very confident that we'll really get to that point where we can reach the longevity escape velocity. Actually, perhaps we're already there. I mean, some people, again, I think that Liz Parrish maybe is already in longevity escape velocity. Why not? And then, of course, only thing for all of us who love life, you know, to live long enough to live forever. And that's where we're all, you know, trying to reach. I'm very confident. I think that our bodies are just as Roger Kornberg, a Nobel Prize of Chemistry in 2006, he came to Spain, in Valencia. He said, life is chemistry, and that's it. I mean, and it's true. I mean, we are made of atoms that bundle together because of certain chemical reactions, and we can intervene on those reactions. It's complex, but there is nothing more than that. So we are getting there, and I'm very enthusiastic about what's going on in the field. I see a lot of papers going out, I mean, being published regarding this theme. I invite all of you to visit my website, which is transhumanplus.com. I have more than 30,000 links, very well organized in a digital library. And there is one section dedicated to life extension, one for animals and one for humans. So, well, that's basically it. Thanks for listening.
Thank you, Andrés. Thank you so much. Ines, your thoughts, please.
Yeah, I think kind of like, I want to address 3 points. So one, I think really is a question of mindset. And in some way we have addressed it all, but I think we really need to go back further and really also understand the psychological side and where it really comes from. So, I mean, there were plenty of tests, there has been plenty of research done on the way we perceive things. So you know, even if you think about the tests done with flies that had been put in a jar, closed for a while, and then once opened, most of them didn't fly out because they did not know differently. And the same, the story with the old men, was in the 70s, the studies, I think, that old men that had been put into an environment where they were supposed to feel and act, behave as they had been like decades earlier. And they actually biologically we're actually younger. So we can do that. But basically, since humanity exists, we have always been dying, and the end of life had always been bad. So we need to change that conversation. We need to change really what's going on in the mind to open up possibilities, what's going on there. And I think also one of the things is in relation to that is sharing more of the research that's going on, sharing more about what is possible. And it is really important, in my opinion, to start talking more from the level where the people are about what is going to happen in the future. What could people do if indeed we can live a longer, significantly longer time? We are living longer already, but people are not realizing that really. It does not really sink in so deep to say, actually, you know what? Living to 150 actually is not such a bad thing, or maybe even living longer. Why not? Because the way we have grown up, all of us, it's just there are only a few of us who can go beyond that, like those few flies who could fly out. So we need to start also thinking about how could that future look like. And like I'm running, for instance, a few interviews with some of the leading researchers and visionaries and entrepreneurs about the future of aging. How will the future look like? So like in the issue that's coming out now this week, we have, for instance, we have Aubrey de Grey, we have Bill Andrews, we have Jim Stroll and Bernardine, for instance. And also then the last point that I want to address is measuring. We have to measure. And like Margareta Colangelo, she has like an article in the magazine as well. And she talks basically about hundreds of biomarkers that are out there and that could be used, but we don't really know yet which ones are the ones that are best for us to use. So we really, really understand. But what can we do as an individual right now? Yeah, start measuring sleep, start measuring the heart rate variability, start measuring our movement throughout the day, start measuring the microbiome. And I would add now, start measuring glycan age, because it seems to be quite an interesting measure for your biological age. And it seems to be quite sensitive to what you're doing in life with your lifestyle. So I'll leave you with that.
Excellent. Thank you so much. The reason?
Well, I would say that the next 5 to 10 years are going to be a case of shoving as much dasatinib down people's throats as the system will bear at this point in time. Senolytics clearly work. We have existing drugs that are proven to be safe in the doses that senolytics are used in. So there should be an awful lot more trials and an awful lot more physicians prescribing than is happening right now, and there will be, I think. But this is going to be one part of a very strong focus on inflammation in aging, certainly over the next 5 years, and I would imagine it will continue for longer. It's well known that inflammation is an enormous problem. It's a very large downstream contributor to many, many problems in aging. But the challenge here, until the advent of senolytics to remove senescent cells, there was no simple way to deal with inflammation. Inflammation was a really, really hard engineering the immune system problem. And the results that actually worked in the sense of, let's say, biologics like Humira that's used for rheumatoid arthritis are not something you would want to give to a normal person who does not have rheumatoid arthritis, because it doesn't just suppress inflammation, it suppresses the immune system, period. The same goes for all of the other therapies that have been developed to date. They're very crude attempts to deal with a very complicated system, and they don't work very well. So the upshot is that now suddenly we actually have a very simple way to reduce inflammation. And obviously senescent cells produce the senescence-associated secretory phenotype that is a strong contributor to the chronic inflammation of aging. Now you have this very simple, very safe way of reducing inflammation, very targeted, very easy to get at, lots of people working on it. The result being that suddenly now, having removed a lot of inflammation, you can see what the benefits are in animal models, and we're starting to see what the benefits are in humans. And that means there's going to be a much bigger focus elsewhere in the research community on what can we do to reduce inflammation now that we know that this is so very important. And I think the follow-on simple thing from Sanalytics is going to be something along the lines of fecal microbial transplantation to reset the gut microbiome back to a less inflammatory state. This also has the merits of being, quote, simple, unquote, on the grounds that it's something that's being done already, and repurposing it to transplant from young to old will be quite straightforward. Similarly straightforward, insofar as anything is in medicine, would be let's create a therapy based upon delivering very, very large amounts of probiotic bacteria to get the right mix. And if fecal microbial transplant addresses the problem in one direction, very large amounts of tailored probiotics should address it from the other. I don't think anybody's actually tried at the level that would have to be done at. You know, grams of the substance taken repeatedly over hours and weeks. But these are very feasible things to work on. They're very simple, quote unquote, because we know they work. So I think that's the next 5 years, 5 to 10 years, a very strong and growing focus on reducing inflammation and aging. And it will, I think, have a quite sizable effect at the end of the day.
Thank you so much, Reason. Fantastic. Dear Odette, your thoughts, please.
I'm sorry, I apologize. Actually, the YouTube was on. That was the reason. I do apologize. Do you hear me now? Yes, I have. And what about this? Yes. Actually, what I believe is the years to come, that we are now growing to new economies. And these new economies, they will be circular economies. These will be digital economies. And the people have to learn how to integrate in those new systems, which will be the years to come, our new way of living, these new lifestyles, where they have to learn to be the master of their own health. And I am afraid that the traditional medicine is having a huge work to do because it doesn't work anymore. That is what we clearly see now. And we will have people who will have big problems with depressions, because we see already now home office is not for everybody the best way to continue in long terms. So we have a lot of work also on the body, mind and soul. And I believe that we have to guide the people to reconnect themselves with the inner part of themselves, reconnect to nature, because nature is showing us the way, and we will have the possibility to go through something new. And I believe this is a very exciting part of a moment in our life, because we have the capacity to go something in a direction where we will be stronger afterwards. So we just have to be very aware that we have to help those people who are not able to make this challenge. This is what I think the biggest work to do.
Thank you so much. That was brilliant. Thank you. And to finish, I would like Naveen, if possible, to wrap it up and to tell our audience, you know, what the future holds for all of us.
First of all, thank you again. I think really enjoyed the conversation. I think everybody added a really good piece to the puzzle here. And I think as many people realize that inflammation is a root cause of chronic diseases, and aging being one of those chronic diseases. So fundamentally, what we are doing at Viome is to understand what is causing that inflammation. Is it really your gut microbiome? What are the kind of things that could be inflammatory here? And how do we come up with precisely the foods that you need to eat and not eat? This idea of somehow we know there is a healthy food for everyone, that is a misnomer. For me, the thing that was causing inflammation was things like broccoli, things like Brussels sprout, things like spinach and kale. Those were exactly the kind of things that most people would consider healthy. So I think we really have to look at each individual of how to reduce the inflammation. Number one, how do you modulate the gut microbiome and the oral microbiome? And I think we need to really, a lot of people are starting to talk about gut microbiome now, but I think what we're starting to see is the oral microbiome is just as much of a key to many of the neurodegenerative diseases and also many of the other chronic diseases. So I think looking at the holistic body, where we are looking at all of the genes that are expressed, the microbial genes in the saliva, the microbial genes in the gut, then looking at the mitochondrial gene expression, the human gene expression, and really modulating them with a diet and dietary supplements are going to be the next 5 years something we can do. Obviously, we can do something crude like fecal transplant, but the problem with the fecal transplant is even if you're able to incorporate a new colonies, and if your diet is completely different, that colonies are constantly changing. That means you have to adapt the diet of the person who you got the fecal transplant from. And again, that tends to be very difficult. So I think it's better to be able to modulate your own gut microbiome, because you don't want to inherit all of the phenotype from the person that you get your fecal transplant from. So with that, I really think I'm very hopeful that in the next decade, many of the diseases that kill people like cancer, we would have gotten hold of ourselves, where people would not be dying from cancer, people would not be dying from in a chronic diseases such as Alzheimer's, dementia, heart diseases. These are the diseases that are preventable. These are the diseases that are reversible. So I really hope that we as humans and humanity will come together to collect enough information about what makes us sick, and to be able to prevent them, intercept them without using any pharmaceutical drugs. To me, pharmaceutical drugs is not a solution. It is in fact the problem. Thank you.